Well, thank you, everybody, and to Forrest and Gary for having me here. I've never been to this meeting before, and I would like to think that if I had to do it again, that I might make a good extension agent, and I really appreciate everything that y'all do. It's so important. You guys are, in a lot of ways, our bridge from the guys doing the business end of things to the regulatory end. So I really appreciate what you guys do. So this is a word cloud I made up the other day after our sessions on Tuesday. And they were the words that kind of came up routinely throughout the talks throughout the day. I didn't weight them because I didn't have long enough to type up a narrative that would do that for me. But one thing that was, I think, came across loud and clear was collaboration and partnership and trust and, all those sentiments. And so as you suffer through my talk this morning, I hope that the term collaboration really sticks with you, because I really need your help and your feedback and input and ideas on how we can make CAHPS move forward. I know we've already heard a lot about the Carol Engel and Jonathan Van Senten work that they've been doing in the different industry sectors, particularly with the bait and sport fish. And they're also out, I think this week, also doing a similar survey on regulatory costs for the trout and salmon industry as well. And certainly APHIS has been supporting that with a number of you in this room as well. One of the questions that was on that survey asked respondents to identify the 5, and again, this survey is on animal health issues, specifically health. And the top 5 topics that had the greatest number of percentage in the responses were infectious diseases already present here in the United States, regulatory requirements, domestic animal movement, environmental stewardship and sustainability, and biosecurity and infectious diseases not in the United States or foreign animal diseases were tied at number 5. Then 2 subsequent questions were, what could they identify as the greatest health risk to their aquaculture farm? Producers were only allowed to answer this question, and their response was emerging diseases and regulatory confusion. And then when asked what was the greatest health risk to all of U.S. aquaculture, the top 3 respondents were inadequate knowledge and training on health issues, emerging diseases, and again we see this regulatory confusion. So we can see from even this preliminary information that animal health, emerging diseases, and regulatory snafus are top of the list of what our producers and all of us have been struggling with for a really long time. Jonathan Van Senten, who I know you all are familiar with, provided me this slide earlier this week. And from the work that they've done in the bait and sport fish sector, and you all are probably already seen the paper that was out in JWAS, he is now preparing a manuscript that will go to the Journal of Preventative Veterinary Medicine, and it will propose the impact of a uniform model for fish health. And we can see from the infographic, which I love infographics, and I know that we've already seen a lot of them this week, but it's a great way to convey, the 3-second message that we can get across. So what Jonathan has found when he was doing the survey on the fish model work were people in favor of a federal model for fish health, and 55% of respondents replied yes, which I think is a very strong message that we need to come together to provide an infrastructure or a concept or a process to address animal health on an aquaculture farm. So he also found that he described 7 different scenarios of how a model fish health might compare to the current regulatory costs and burdens that they have. and he found that with a uniform, consistent model used here in the United States across all aquaculture, across all states, could reduce the regulatory cost per farm by $83,000. And so that's really significant. And so again, we're really, the time is now that we start to address this long standing issue for our producers and alleviate some of our headaches along the way. We can see here that average regulatory costs accounted for about 25% of all farm costs, and you can see from the pie chart there that really fish health testing was pretty small piece of that, but when you look at the other components that go into the how we do fish health testing, it's the labor of time of the guys working on the farm to seine up the animals, the cost of the veterinarian, the shipping of the diagnostic samples, if that's incorporated to that as well, all becomes very significant, and we need to work smarter and more efficient and to create information health status for our farmers that is very meaningful and will be recognized not only by our international trade partners, but also by our state departments of ag and natural resources. So I really was invited here today to talk about the Commercial Aquaculture Health Program standards. And I really need your help. And it's not just me. I stand up here with various representatives from the National Aquaculture Association that really came to APHIS with what the challenges that have already been described. How can we work together to solve this issue of regulatory confusion, lost or unrealized markets, so that we can expand aquaculture and have our products move easily within this country and as well as around the world. So what is CAHPS? CAHPS is an animal health management plan for aquaculture businesses. It is flexible enough that it can be used in other scenarios as well, such as state hatcheries, federal hatcheries, but it really is specific to the business model that of the particular site that it's applied to. So why should we have a CAHPS program or a national aquatic animal health management plan? We need to be able to assure the health of our farm-raised aquatic animals, not only to move them more successfully, but to also protect our natural resources. And because of how we have structured CAHPS, the animals can be considered lower risk for specific diseases because of the biosecurity practices and surveillance plans that are put into place under this management plan. It would facilitate an animal movement. Of course, this assumes that states would recognize participants in the program. Also that our international trading partners would recognize what we're doing. CAHPS would have oversight from APHIS, but we need partners at the state level to ensure that there is compliance with the principles that I'll talk about in a minute. Marketing and branding, again, our aquaculture producers, we heard a lot about telling the story and developing their story and how important that was, and I am a big believer that we really need to help our producers tell their story about why their products are so high standard and delicious and everything else. And so this provides a marketing and branding opportunity for U.S. aquaculture. It can also complement other programs that are already in process on the farms, such as other certification programs, food system biosecurity, food safety, and even the devilish word of animal welfare. If we are practicing and managing the health of these animals, we can say that we are indeed being very considerate about the care of our animals that we are responsible for. So very quickly, how we define health, and if you will, think of the farm as the big, large animal. And so down on the bottom of the pyramid, we've got the big fat daddy farm, that's kind of the big picture. And then we can move it to smaller and smaller units on the farm. So then we go down to system health. How is your system being protected? Are you using open protected waters protected waters closed system, or are you in an open system such as our mollusk industry is often in these very open aquaculture setting environments? And then of course we go down to the very much smaller level is animal health. And all of us that are doing this work realize we are not dealing with the individual animal, we are really dealing with herd health, livestock management. When we're talking about these huge populations of animals on the farm. And so it's important that we look at that big picture of herd health on a working farm. So farm health is the broad sense of farm biosecurity. It is dependent on the region around the farm. Are they open, susceptible to endemic diseases? Are there natural disasters that this farm would be vulnerable to? And so we have to take into account those types of vulnerabilities around the farm. Doesn't mean that you can't have farm biosecurity if you're surrounded by IHN, as we know we are out here. And we heard a couple of the producers lament about that yesterday. And how do they could keep their stocks free when they have IHN all around them? And certainly we can establish a surveillance plan and biosecurity practices that recognize that risk, but can mitigate and hopefully lower the risk of the impact of that disease on their farm. And of course, farm health is dependent on the farm-wide biosecurity. I know I'm preaching to the choir a little bit, but system health are the units that are rearing the animals, the design and suitability for the species. Again, it's dependent upon that water supply, and it's also very much dependent upon the management, the maintenance of the system, how it's cleaned, how it's broken down, how it's treated on a daily basis to make sure that we are achieving a usable, efficient system to grow our animals in. And then finally, again, at the top of that pyramid, we have animal health. When I'm a big, like, what the heck does Google think this word means? And so even if it's a silly word to maybe look what Google thinks health is, but they claim that it's the state of being free from disease or injury. But I think that we all recognize that it's really more than that. It all goes into genetics, nutrition, husbandry, immunity, and how all those things together, again, make that picture of animal health. We also have to recognize that health is on a continuum constantly. And when we look at this continuum from the left to the right there, we have optimal health on one end and disease and death on the other, and we're always somewhere on that continuum. What we want to do is to be able to detect problems with our animals early enough that we don't get so far down that continuum that we need to use antibiotics, that we need to cull the dead or moribund species out of our systems. And so the earlier that we can detect disease issues on the farm, the more successful we will be at combating those issues using less invasive type solutions for the problem. So our CAHPS approach, again, is a comprehensive health management plan of livestock. The plan was developed with industry. This was not an APHIS or a Kathleen Hartman idea, although I totally have sold my soul and believe in it. But this really came from industry to USDA saying, hey, we want you to be our daddy. We are agriculture. And we need you, APHIS, to stand up and help us be healthy and able to move our products around the world and around this country with ease. It's a non-regulatory approach, which was also one of the demands from industry. They don't want more regulations, and so we were very sensitive to that. Fortunately, with the last two administrations in the White House, that has been very much in favor of developing alternatives to rulemaking. We all understand that developing regulations takes a lot of time, and by the time we have a regulation, something's already been found wrong with it, and it's on the books, and it's very difficult to change. So we wanted to keep it very flexible. While we wanted it to be non-regulatory, they also wanted it to be voluntary. And so I struggle a little bit with that, but I looked to the NOAA Seafood Inspection Program, which is also non-regulatory. It is a voluntary program with mandatory compliance. And so when we think about CAHPS, and we'll go into the 5 principles of CAHPS in a second, it is voluntary, but if you decide that you want to participate in CAHPS, it is mandatory compliance that you enforce all 5 principles of the CAHPS program on your farm. It's an auditable system. It would have oversight from federal and state governments. It has to be accompanied by documentation. And finally, the highest criteria probably is that it's science-based, flexible and responsive to emerging diseases, diagnostic technologies, other technologies. I mentioned the other day about televeterinary medicine. How can we work that into the system and make our veterinary assessments as effective and efficient as possible? And of course, we have to have scalable surveillance strategies. I know Anita, Kelly, and I share a very strong sentiment that the current system of testing 175 animals or 150 animals twice, once a year, whatever, if that's great, but we're testing healthy animals. And we do it every year, year after year after year. And we are collecting data on healthy animals. And we're claiming that establishes the health of this farm or that population of animals. But we really need to do it smarter. We need to be able to scale our surveillance strategies to meet the risks of the practices or the environment that the farm is involved with, and also meet their business needs. So if everybody raises their right hand, 5 fingers, awesome. And also remember on your evaluation form, Hartman, 5. Hartman, 5. So, all right, so.
Thanks for bringing that up.
Oh, yeah, no worries. So again, Hartman 5. So I have to always take a memory stick with me, and my hand's a good one. So there are 5 principles of CAHPS, and there's no, it wasn't an accident that it came down to 5. So again, the 5 principles are that we have an aquatic animal health team. I have 5 minutes left.
Oh, no.
You had us doing this. You're a little
Sorry.
slow. That's why we set up front.
Okay. Risk evaluation, specific pathogen surveillance, investigation and reporting, and response and recovery. And I'll go through each of these. As one of the requirements for the CAHPS program, you have to have a written site-specific health plan. And so across the top here, we've got the 5 principles we just talked about. And then I've broken down what I would expect to see under each one of those categories in a health management plan. If you guys have ever been through a business plan, it's kind of similar to that. We've actually been trying to work with the folks that develop Fish Biz Plan so that we can develop a similar solution to developing these very labor-intensive documentations. But here you see, so to be in CAHPS, you have to document each one of these 5 principles and the practices that are being done on the farm. And this is really where I really need y'all's help here too. So the first principle is developing a health team. Too often what I have found in traveling around the country and talking to producers and veterinarians is that there is no relationship with a veterinarian. The health relationship is with the diagnostic laboratory. They really rely on the diagnostic people that are, running and processing their samples to give them health advice. Now, in some cases, I think that works really well, but it's it's one step removed, and I think we're really missing an opportunity to have a veterinarian involved in that process. Instead of just having the veterinarian come out, sign their name on the certification line, we need to have that veterinarian involved in the health practice on the farm. And I realize that sometimes veterinarians can be difficult to find, difficult to work with. But we really need to embrace that profession, and not every site has to have a veterinarian. To participate in CAHPS, if you don't need to have health certificates issued, you don't need to have a veterinarian on the team. Would I recommend it? Of course, because I am a veterinarian. But again, we took this team approach from my experience in the dairy industry back a million years ago, that when I was milking cows and raising the calves and stuff, that it wasn't just the farm manager, it wasn't just the veterinarian, it was the nutritionist, the geneticist, the theriogenologist, the DHIA milk sample people that would do the microbiological testing. It was really a team of people, and that team of people would actually get together with the producer or the owner or the farm manager and sit down and look at the data that they were collecting on those animals and review and determine, hey, looks like we need to increase milk production. How are we going to address that? It looks like we've got too many cows getting mastitis. How are we going to address that? If we don't go through that very thoughtful and targeted process of the issues for production on a farm, we're really not providing a good service to our industry. So the team must identify a leader. They have to establish a communication plan. That communication plan is not going to be prescriptive in any form, but it has to be able to demonstrate that, yes, our team communicates on a monthly basis through emails. You know, we're keeping records of morbidity and mortality, and when we have a spike, we communicate that and we address the issues. And of course, we want to prioritize the health goals for the business needs of the farm. So the second step is risk evaluation, which has 3 steps to it. The first step is risk identification. So we identify the pathogens of concern for the susceptible species that we're growing or producing on our site. We're not talking about testing salmon diseases in koi, right? Let's move away from that mentality, and so that we specifically identify the pathogens of concern. Certainly, we're going to look at the big, bad, internationally regulated pathogens that are found with the OIE listed diseases, but these can also be pathogens that affect animal production on the farm. Francisella, Flavobacterium psychrophyllum we heard about yesterday, columnaris. If those issues impact production, we need, again, this team approach to think about how we can help alleviate and prevent losses to each of these. And then we need to do a pathways of introduction onto the farm. And so it needs to be a very thoughtful process throughout how we do this. And then, of course, with that identification, we need to characterize that risk. What is the degree of risk, the scope of risk, and the impact of that risk? Are we going to show up in our white biohazard suits and depopulate everything? Or can we simply handle it by treating with antibiotics or developing an autogenous vaccination system? And then finally, the third component to this is risk management. And this is where a biosecurity plan comes into place. You cannot, in my opinion, have a biosecurity plan until you go through the first 2 steps. You can't just have a general, generic biosecurity plan. It really does need to be site-specific for the pathogens of concern, for the practices that are going on the farm. I always start with a farm map, and it doesn't really matter what that farm map looks like. These are different ones of our, I work out of the University of Florida's Tropical Aquaculture Lab, and we have all of these different types of documents that we use to identify where animals are on our farm, if we need to hold animals before they're moved, that kind of thing. So not only is animal movement an issue, but water flow also is an issue, and we really need to be thoughtful about how our water is being moved around the farm to identify what risks are where, In the ornamental industry, we have a lot of different species growing on the same farm, all having different susceptibilities to different diseases. And so identifying where water goes on your farm, thank you, needs to be an important component of that. So then we come down to biosecurity. Biosecurity over the last decade, I think, has really changed. Instead of saying, yeah, I've got a foot bath, yeah, I've got a hand wash station, it's really why do you have these things and why are they placed where they are? When I first got down to the lab in Ruskin, we started talking about biosecurity, and the farm manager went around and got all these really expensive foot bath mats and invested a lot of money. And then I finally, as I got a little bit smarter over the years, I said, you know what? It's dumb to have those foot baths where we have them. They're not effective. In fact, they're completely ineffective, and it gives a false sense of security where we have them. So we need to be smarter about our biosecurity practices, because we all know that biosecurity can be very labor intensive and kind of expensive when we're talking about the disinfectants that we need to use. So our biosecurity practices need to match the level of risk for the site. So I know we have all heard this before, but again, Hartman 5. So biosecurity goes on one hand, and we need to examine each one of these risk pathways, animals, water, feed, vectors, and fomites that are moving around our farm. So the biosecurity plan as part of CAHPS would have to identify the risks of each of those, again, for the pathogens of concern for the animals they're growing. Of course, I heard at one of the farms yesterday that, we're disease-free. Well, how do you know you're disease-free? Well, we don't have any dead animals. We're pathogen-free. How do you know that? You can't possibly know that unless you are doing surveillance. And so surveillance is absolutely a mandatory component of CAHPS. But we need to construct the purpose and boundaries of that surveillance. Do we need to create a specific pathogen-free farm? Do we need to establish that this farm is secure from an endemic disease that surrounds the farm? And so we need to know whether we're doing a compartment, or are we going to be part of a zone, like with our mollusk industry, where they're in an open water setting, but if everybody is doing surveillance together at the same rate, using the same diagnostics, that becomes so super powerful in about being able to determine the health status of the region of these animals are growing in. And it will begin to alleviate the number of animals that need to be tested. So within CAHPS, we've decided to stay very science and risk-based. We're using observational and risk-based surveillance. Thank you. Is that a joke? Hopefully. And so here, again, we want to stick to that scalable surveillance strategies where we can start off testing 150, 60, whatever the number might be dependent upon those identified risks. But then it should be scalable. We should be able to use that data and the history of that data to then say, okay, we can scale this back. We know what our risks are. We're targeting those. And then we can begin to draw back so that we begin to start targeting animals that are actually sick or dying or fresh deads. And those are really going to be the most bang for our diagnostic buck when we start talking about the health of these animals. Testing healthy animals is archaic, I think. We really need to be targeting the dead animals or the sick animals. But we also need to know about the pathogen, and I'm going to speed this up a little bit. But again, these are all things that we need to consider when we're constructing that surveillance plan, how the pathogen behaves, and also the diagnostics that are being used to detect those pathogens. What's the sensitivity and specificity? And if we need to adjust our numbers to make those more powerful, we can do that. This is just an example, and I won't go through this, but we work with a tilapia cooperative in North Carolina, and this was how we have constructed their surveillance plan based on their animal critical control points, and they fortunately have one source farm, and we can test at these various points that you see here identified in red. So we're not testing every population. We are targeting our testing at areas where we think we would have the greatest impact and control if we were to find something at those points. If we have a disease outbreak, we need to know how to respond and investigate those. And we can't do that unless we have specific thresholds of morbidity or mortality on a farm. Yesterday, I'm sure we all identified that they had some deads on the farm, right? And so it's a farm, right? I mean, we're not going to expect not to see any kind of pathogens or dead animals there. But what if we saw a whole raceway of dead animals? That's different, right? Seeing a couple of dead ones is one thing. Seeing a couple of animals flashing, that's one thing. But your alarm bells and your guts should start getting really queasy when we start to see a whole raceway go down. And so we need to help our producers establish those thresholds. Last year, we were out at a farm, a trout farm in Washington State, and we were going through the CAHPS exercise. And they, from their mortality records, we were able to determine that their site-accepted level over 5 days was 0.03%. There were 70,000 fish on the farm, and so this would total 21 mortalities per raceway per day over 5 days, right? So it comes out to be about 102 animals. And so when we were investigating the activity on the farm for the last 5 days, we found that there were 102 mortalities. Well, that's getting pretty darn close, right, to that acceptable threshold level. It's not over it, but this should be like, what could possibly be going on here? And so when we started talking to the farm managers and reviewing the activity on the farm, we found that 68 of those mortalities were completely justified by the activity that was going on the farm. They had just gone through their August spawn. These animals were recovering from that post-sorting stress and the post-spawn recovery time period. And so we then were like, okay, phew, this seems like normal, expectable activity for morbidity on this farm or mortality on the farm. And so again, having this type of system to help our producers identify when they truly do have a problem, and that we're not overreacting or knee-jerking to finding a dead animal on a farm. Again, this is animal production. I'm hurrying.
We started early, so...
Okay, you're not hooking me off yet?
I'm giving you a little bit of
Okay,
slack.
thank you. Sorry. So then we also have a responsibility to our natural resource partners in this, and our global trading partners about pathogen reporting. Not all pathogens are created equal, but we are a member of the OIE, or the World Organization for Animal Health, and there are some pathogens that we need to report on a global level. And so we also have states that have reportable diseases. And so when we find these, we need to know what the responsibility is of the farm. USDA is coming out, and it will be regulation, the national list of reportable animal diseases. Right now in this country, the only folks that are obligated to report are our accredited veterinarians in laboratories that are inspected by USDA. Those are the only people that have to report, which is a huge loophole, and our trading partners recognize what a huge gap that is. The new NLRAD addresses that gap, and it will be the responsibility legally of anybody working with those animals. If they identify a reportable pathogen, they must report that. Farm owner, farm manager, veterinarian, extension agents would all be expected to play a part in that. And so with that, we have to develop a lot of trust, right? Because nobody wants to have their livelihood and their livestock depopulated because of whatever. And so, again, it's trusting that USDA isn't going to show up in our white biohazard suits and demand a depopulation. I mean, we really do have to be thoughtful about the impact of those. And finally, the response. Having a contingency plan. What is our response going to be? Can we treat it? Can we vaccinate? Should we depopulate? Do we have to depopulate? And then how do we get the site back up and back into business? And of course, we always have to be reflective about these diseases happen, we need to think back, well, how did this happen? Is there something that we haven't addressed and we need to update and change the plan? So always measure the success. I'm certainly a huge advocate for cost-benefit analysis. We've got a great ag economist on our team now for USDA, and we're really trying to make it more effective, more efficient, and more meaningful than what we have going on now. So the importance of CAHPS is definitely this team approach. Biosecurity and surveillance practices establish the farm animal health. National adoption of a uniform health standards minimize redundancy and meaningless health regulations for animal movement, not just within this country, but also it provides leverage for APHIS to negotiate with our trade partners that we have a health plan, a framework in this country for commercial aquaculture, and then offers branding and marketing opportunities. The challenges that we've identified so far has been the struggle with developing a site-specific health plan. Nobody has time to draft one of these. And so we recognize that. We've been reaching out. We've applied for a different number of grants to help us get a web-based platform that, like developing a business plan, you can go in there and do that. Data management and analysis, confidentiality is a big issue for our producers. I don't want APHIS to collect disease information. That's why we need that team in place so that they can collect that data and it's not being collected by the government. We need access to more experts. Certainly one of the big issues for the industry is access to veterinarians. We need to identify these folks, engage them. My preference is to really start targeting the large animal veterinarians. They have that certain swagger of being able to walk onto a farm and get the concept of herd health. And finally, we need recognition of the producers that are doing CAHPS so that they can really take advantage of a uniform plan across the country. So, what can you guys do to help? Be a part of the solution. You know, have the mentality we can if, not we can't because. We need to really start thinking about, I realize there are obstacles, I realize that it's going to be hard, but we really need to think about if we can solve this one thing, then maybe we can do this. We need to talk about CAHPS. Please share your ideas on how to make it work and find producers that are interested in participating. I have some money for cooperative agreements, and so to start a CAHPS program with a group of farms. So please let me know if you think some producers in your area might be interested in this. And then finally, just a plug again for Aquaculture America 2018. I hope to see you all there. And again, we just came up with this logo. I think you guys are the first ones to see it. Even though we'll be in Vegas, we really moved away from the Vegas logo theme, and we really want to emphasize the shaping the future, telling the U.S. aquaculture story. So thank you. I'm sorry to go so long.
Time for one quick question.
Yes.
You spoke several times about employing, utilizing the vets that are out there. How many of the vets that are out there are willing or able to really sit around and talk about fish?
It's
Could you repeat the question, please,
Yep,
Mike?
of course. So the question was from Bauer Duke, how many veterinarians are out there that are ready, knowledgeable, competent, confident to talk about aquaculture? There certainly are some. It's not as many as we would like. We are trying to develop strategies to, again, reach out to large animal veterinarians that are used to riding around in a truck, being on a farm. One thing I think that CAHPS gives veterinarians is a tool to take onto a farm to help them establish a framework for health management on the farm. So instead of just throwing a veterinarian in there and saying, hey, solve all our problems without antibiotics or whatever, And so it really does give them at least a framework to start with. I recognize that it's a big issue, but we do have some veterinarians out there, you know, walking the walk, talking the talk. The important thing to remember is, right, it's kind of a vicious circle, the chicken or the egg. Aquaculture producers feel like there aren't enough veterinarians to work with them, and the veterinary profession doesn't see enough business opportunities for them to supplement or pay for a full-time practice. So we need to solve that issue as well.
Thank you.
Yep, thanks.